Hello, Namaste. I welcome you all to the 97th session of Gurubodha. I cordially welcome all the participants to this session. We have Dr. Aman Kapoor joining us today, a celebrated dentist who's practicing dentistry, then turned into Ayurveda, patient connection, then online marketing, digital marketing, various fields. He's a multifaceted personality. We'll get to know more about him as this episode goes through. On behalf of us, all of us, I cordially welcome Dr. Aman Kapoor to this session. Good evening, sir.
Good evening, sir. Good evening. It's pleasure to be here with you. Nice to connect with you and Raghuram sir again back. And good evening to all the participants over here.
I cordially welcome Dr. Raghuram sir to this session as well. Good evening and namaste, sir. This session is brought to you by easyayurveda.com. I dedicate this and all of my works at the holy feet of Dr. H. Chandrasekhar Udupa. This class is made live for Easy Ayurveda weekly class subscribers. If you have not done that, please go to easyayurveda.com/video-classes. Dr. Aman Kapoor is a dentist and then he was involved in the digital transformation in patient care at Madhavbaug, and the podcast that he was doing that he's doing with Madhavbaug on preventive cardiology, titled the Heart Guardian Podcast for Healthy Heart, which was hosted by Dr. Aman Kapoor and along with eminent cardiologist Dr. Jagdish Hiremat. He is now listed on the Maharashtra University of Health Sciences, that is the state level health university of Maharashtra website, in the digital library. So congratulations to him. And also LinkedIn India has recognized Dr. Aman Kapoor as one of the LinkedIn top strategic communications voice, a unique feat. So we have Dr. Aman Kapoor. So Dr. Aman, before we get into the topic in detail, please, because you have too many facets that cannot be covered with a PowerPoint slide, can you please explain a little bit of your journey after your graduation to till here, what and all you have done and what are you currently up to and all?
Yes, yes. I hope my audio is clear to all of you.
Yes.
Right. So, first of all, welcome. Good evening to all the people those who have joined in over here. Sir, thank you for inviting me on this platform, Janardhan sir, and interacting with you and Raghuram sir and the whole Easy Ayurveda team has always been a pleasure for me. My journey began in '99. I graduated as a dentist, and once I finished my dentistry, got into practice, was into surgical dentistry, cosmetic dentistry, and prosthetic dentistry. Did a lot of different things in my dental practice, but there was one area that always excited me was paper presentations and scientific presentations, lectures and workshops, etc. So 2008, I moved towards corporate sector where I started working in the field of oral cancer prevention, and that was with a AI-based diagnostic company which was based out of US and partly out of Israel, which utilized AI-based technology for oral cancer pre-diagnosis. So that was my first corporate move that I made, and from there I moved across various sectors ranging from scientific marketing, working with 3M India. How do I put it? 3M is one of the world's biggest multinationals and most commonly known in the healthcare sector for the Scotch tapes and the Littmann stethoscopes. And if you look outside healthcare, the Scotch Brite and the Scotch tape and the sticky tape and the post-it notes are the most commonly known 3M inventions. So I was a technical specialist for them. Used to manage key opinion leaders, conduct my own workshops, hands-on lectures for doctors. Moved on from there into stem cell industry. Moved from there into hardcore learning and development with a dental chain. From there, I moved from hardcore, dental chain into sales and marketing for dental equipment, and I was championed high-end dental equipments and medical devices, which included lasers and CT scans, etc. From which I moved into orthodontic industry. From there, I moved into Madhavbaug, as my last stint was at Madhavbaug, where I was started as a head of learning and development. Then I moved into DM of digital healthcare. And currently, my focus is towards building A Connects, which is a brand of mine. It's a philosophy of mine where I believe that we need to get connected, especially in healthcare. There needs to be a connect and only when a connect and a bond is developed, things can work across ahead. So that's the area. I have conducted over 3,500 live sessions for patients and doctors, and taken about 500 plus odd webinars in the last couple of years, and lectured in about 60 odd cities. That's to put it in very short about myself.
Thank you, sir. And so to begin with, doctor and patient relationship. Of course, when the patient enters into a doctor's consultation room, it is given that the doctor is skilled and patient has trusted. Now that with the lot of online information about medicine, treatments, disease, etc., everything is available. Still, the patient has taken a pain to say get into his car or a taxi to come to the clinic and enter into the patient's doctor's consultation room. Doctor's knowledge is given and it's granted or it's taken automatically, and doctor's experience, his skill set in diagnosing and treatment, they're also taken. So apart from the doctor's medical skills, what other skills that you would rank as a say 1, 2, 3, and out of the many skills, what is the, like, number one skill that in today's day and age, when everything is controlled by how we present ourselves, how we talk, etc., what is that one killer feature every doctor should have as per you?
Right. It's not just for doctors, it's in any industry. There is to be really successful, you have to have a balance of two skills. One, your core skills, your hard skills, diagnosing your patient, the knowledge of your medicine, knowledge about a field, differential diagnosis, and pharmacology, and etc., etc. So that's one area which definitely you need to have. But to be really successful, the equal important is often misquoted as a soft skills. I would say these are misquoted. And why? Because these are not really soft. These are as hard as the hard skills. They are hard to develop, and they are equally, if not more important. Because I say that the important point over here is that very, very famous sentence, I often quote: patients or other people don't care how much you know. I know that's a very controversial statement coming. We are on a learning platform and we are talking about knowledge sharing. And I'm saying patients don't care how much you know. Well, that's an incomplete sentence. Let me complete this for you all. Patients don't care how much you know until they know how much you care. The first and the most important bond that is built is a bond of trust, is a bond of care, and a bond of communication between a doctor and a patient. And until that is built, nothing else works. So what is important for a doctor is to be a person. How do you show you care? Yeah, I mean, you have to be connected to the patient. You have to build a connect. You have to build a connect. That means you have to have good communication skills. You have to have people skills. You cannot just be a healthcare practitioner where I am a doctor and you have to listen to me. That doesn't work, because one of the most common things I've been telling all doctors in my career is that no matter how much knowledge you have, as a doctor, it's of no use if you don't have a patient in front of you. Your existence as a doctor or a healthcare practitioner is valuable as long as there is somebody who needs your skills. If there is nobody who needs your skills, then your worth is zero. The worth of those knowledge and skills are zero. So you have to build a connect. And so I would say, apart from your technical skills, core skills, which I do not say that are not important, they are important, there's no doubt about it. But equally important is your communication skills, your connecting skills. I would say it's ability to build a connect and care. That's the most important skill.
Yes, sir. But there is this a doctor would invest so much energy into building his knowledge database and
Right.
setting up his clinic, and managing other people is very hard for a
Mm.
doctor who,
Mm.
for the most part, would be an introvert, spending thousands of hours in his dorm room, hostel room, just fine tuning his skills, learning new things, and to become the doctor. And there's also this one is that introvert part, and there is another one like shyness part. These come in the way of free communication for a doctor. So someone who is starting an Ayurveda medical practice and who does not know how to communicate well, how to build that skill? What could be the steps involved?
Okay. So everything starts from the basic aspect of caring for the patient. If you care for the patient, what do you do? Okay. So I'm going to ask questions to everyone over here. What do you do for a person you care? When a person who cares, you care for, is in pain, is upset, or is in trouble, what do you do for that person? Okay, TLC, very nice. So what do you do with TLC? How do you show you TLC? So Dr. Swapna, very nice. First try to comfort, very nice. Joe, fantastic. Mara Cummings, absolutely lovely. Listen, tender loving care, yes, I understand. I mean, Dr. Swapna, I understand what TLC is, but I want to ask you is, how do you ensure, how do you show TLC to the person? Listen to them properly. Listen to them properly. Dr. Willem, Dr. Akshada, absolutely amazing. Dr. Victory, listen. Mara, listen. Absolutely, you're on spot, right? Nobody needs to be a rocket scientist to just listen. When the patient comes into a doctor's chamber, sits in front of a patient, there are two things that the patient needs. Is a doctor who can understand his or her pain. So if you see this, what you have realized, when a patient walks into your clinic, the only thing that the patient is asking from you is, doctor, please understand my pain. That's the most basic thing that the patient is expecting from the doctor. And I'm sorry to say, but the doctors have a tendency that we feel like we want to show our expertise. I am the doctor, I know more. And we try to over educate the patient so much that if a patient sits for a multiple choice question tomorrow, he might pass that. That much is the level of education we try to spend to the patient. So as a beginner or even as an expert, the first basic thing is listen to your patients. And there is a very big difference between listening and hearing. Now, suppose if I asked you a question, any one of you, can you just ask? I mean, I asked you a question, and when you are answering, let's do this activity. Can somebody, can anybody start answering a question? Let's say, for example, tell me something about a day in your life today, or some really fantastic event in your life which you love to talk about. Can somebody tell me about it? For that matter, Raghuram sir, why don't you tell me something?
Absolutely, sir. So today is a really good day having Aman Kapoor sir is here with the Gurubodha session, waiting for long to have some share of wisdom and share of thoughts. So the day began superbly with regular dinacharya, so day-to-day activities. Today we have birthday of our Dr. Hebbar's beloved wife and Dr. Kartayani. So we celebrated her birthday online, offline. So a lot of wishes going her way. So other things are going as routine. So expecting a lot of rain at Bangalore here. So light showers we had.
Uh-huh.
So
Okay. You're saying something. Sorry. Oh, sorry. So sorry. So,
okay, sir.
Raghuram sir, give me a frank feedback. What did you feel just now when you were saying something? What did you feel?
Yeah, so I felt that you had some small diversions here and there. So Aman sir was there. So I was thinking he was, yeah.
Absolutely. Absolutely. I mean, if you're sitting in front of me, you're saying something, and I'm not even paying attention to you, looking at your
Yes, yes,
face. I'm busy taking down the notes. I'm, picking up my mobile, looking at the text, talking to somebody. There'll be a point we'll stop talking.
absolutely. There were distractions and diversions which we could note. So this is this
Right.
is this is
It is.
online. This is online, sir. So see the other
Even
aspect
in
is
online, if you feel this much,
yes,
imagine if this
yes,
is in face, sitting in one to one in a room, and a
yes.
doctor is busy. You're telling me something, and I'm just writing down notes.
Hmm.
Just writing down notes. Are you going to really feel connected to me as a doctor?
Absolutely not. Absolutely not.
Yes, you won't be feeling that. Everybody, right? Right, Jay, victory. I mean, absolutely. Nobody will, patient will not even give you the story. And the science says that 69% of the the second opinions that take place happen because the doctors felt that the patients felt that the doctors did not listen to their story or to the whole story. We
Absolutely, yes,
don't
sir.
need rocket science skills. We just need basic human skills. And patients don't care how much you know until they know how much you care. Patients don't care how much you know until they know how much you care. Now, simple thing is, I want to ask you very few questions. Everybody, can you answer these questions? Why are you here today? I mean, you all have joined in, you spend your time today. If you were to put it in very short words, I mean, why are you here today? Why did you join this session? All of you are practicing doctors for wisdom bites. Very nice, right? There is some reason behind. There is a why. To learn. Thank you so much. We are here to experience something. We are here to learn. We are here, whatever may be a reason, there is a why behind it. Why does a patient want to come to you? Why should a patient want to come to you as a doctor in first place? The patient can just walk in. It's not like patient is having a typical ad or thumbs up. Aaj kuch tufani karte. Let's do something really, very loud. Let's have a blast. Let's have a fun. Let's have a major dynamic explosive day, and let's walk into a doctor's clinic. Anybody does that? No patient is going to walk into a doctor's clinic to have fun. Everybody comes into a patient walks into a doctor's clinic because of some reason, right?
I
Patient
have a,
travels to you. Yes, sir.
I have a question. Do you have an answer? That's what the patient wants.
Yeah, I mean, patient does not, it's not always just simple. Patients want somebody to listen, somebody who can listen to them. Patient wants, it's a very famous saying, listen to your patient, he's telling you the diagnosis. Listen to your patient, he's telling to your diagnosis. Why does the patient want to come to you for treatment? I mean, don't take it personally. Patient has a choice of going to anybody else, right? Even in Ayurveda, there'll be 10 Ayurveda practitioners where you practice close by. Why specifically patient should come to you? What makes the patient want to be with you? And this question, I think Hebar sir had already answered this in brief. Which is the biggest distance that the patient has to travel from home to the clinic or from one city to another city when it comes to taking a treatment? Which is the biggest distance that a patient has to travel? Anybody, any guesses? It is the distance between your consulting chair and your treatment therapy chair or therapy table. That is the biggest distance. The distance that the patient has to travel to come to your clinic is nothing compared to this. Is the smallest distance. It could be few feet, but it's the biggest distance because that distance the patient will not travel until and unless the patient is ready to believe that you are there for that patient. What you're saying is caring for the patient enough. And that's the reason why basic of communication starts with showing that you care. And the simplest thing you can do is give your undivided attention to the patient. And what does the patient want from you? Patient wants a doctor who is going to listen to you. A patient wants a doctor who's going to understand what my real pain point is, and a patient wants a doctor to understand what do I really want. Now, if I go ahead, this is what I was trying to say. Patients don't care how much you know until they know how much you care. And what is the basic of communication? If you understand your communication, if you break down your communication, whatever words you use, if you want to simply understand a communication, is that what words you use only forms 7% of your communication. 38% of communication comes from the tone of your voice and 55% comes from the body language. Simple, even on screen, if when I was not looking towards the camera, when I was facing my mobile, my back was towards the camera, you felt disconnected. Imagine what it is in front of the patient. So basics of communication starts with basics of knowledge of communication. One, listen to your patient. Now, one more question I would like to answer, and I would request everybody to answer on that. Ask the question is, let's say in a communication, a first consultation, the patient has come to you and the patient is spending, let's say, 40 minutes, 30 minutes, 40 minutes, 50 minutes, whatever time you take for consultation. But statistics say the doctors take about 5 minutes to 7 minutes for consultation. Ideally, they say 15 minutes. And some doctors say, I take 1 hour, 2 hours for consultation, whatever time you take for consultation. Let's break it into percentages. What percent of the time do you as a healthcare practitioner, a doctor talk, and what percentage of the time does your patient talk? Can you put that in your chat box? What is your current experience, percentage of time you spend versus the percentage of time the patient spends talking? So let's say if you spend 60% of the time talking and the patient 40%, then type 60-40. If you spend 80% of the time talking and the patient spends 20%, then type 80-20. If you spend, let's say, 70% of the time talking, explaining to the patient, and patient spends 30, then type 70-30. So just type numbers in the screen. I would request everybody to share that experience. And while you talk that, 30-70, okay, 30-70, doctor talking 30, okay, doctor talking 40, patient 70, doctor talking 70, patient 30, very nice. 40-60, very good, very good. 50-45, 55, very nice, very nice. First consultation 60-40, okay, very good, very nice, thank you so much. Others, I would request everybody to share. There's nobody right, nobody wrong. 50-50, okay, that's a very safe route to take. 60-40, but it should be 90-10, okay. Now, let me tell you very frankly, a successful consultation or a communication will be the one where the doctor spends not more than 30% of the time talking. When a patient spends 60% to 70% of the time talking to the doctor, and the doctor only talks 20 to 30% of the time, those consultations are more likely to succeed. Those patients are more likely to take your treatment. Those patients are more likely to listen to your suggestions, and those patients are more likely to be compliant. Right? Do you agree? Don't agree? Because one, if you allow your patients more time to talk, your patient is going to open up. Of course, there is a philosophy of what questions to ask, how to ask you the question. That's a topic of different discussion. We can talk hours on that, but I'll just put it in very brief. This is how it is. And also, when you talk, how do you talk to the patient? Whether you talk continuously at the same tone, same pace, same voice, and you spend the same knowledge and the same information, you keep on giving the information to the patient, and the patient keeps trying to talk, and you keep talking in between, and the tone is the same and the voice is the same, and it is the same. How much of did you understand what I said? So remember, what you talk, how you talk matters. Also, what matters is to understand the body language of your patient, and what body language are you showing to your patient. These are very important parts of listening. I know everybody say listening is something that we do with our ears. No, listening is do with our eyes also. Listening is something that we do with our eyes. We listen, we see, we analyze the body language of a person. There are open body language. There are some body stances that you would expect when you are actively talking to a patient. And there are some body stances you would expect a patient to showcase when you are telling them findings of your right? And then there are some findings that body language you would expect to showcase, patients to showcase when you're telling them the right, the crux of the treatment. And there are some body languages that show you that you are lost. You are lost to the patient. Raghuram sir, I think there's something you wanted to say.
Absolutely, sir. But there are other species also. Like
Right.
some patients may have an opinion. Like I spoke a lot, like 90 words, and the doctor didn't even speak 10 words. What was that horrible response? Number
Very
one.
good point.
Such type of patients are also there. And in Ayurveda, one more point I want to put it, sir. I've done so many consultations and online consultations, video consultations also. How it works in Ayurveda is people want Ayurveda doctor to speak more and explain because they're new to the Ayurveda pattern. They want to,
Understand.
they explain their problems. Okay,
Right.
patient's hearing is done by the doctor.
Mm. Mm.
I do that. Then immediately the patient puts on a few queries and it comes to our table. And there the doctor's time is more than the patient's time many times. And all those patients have given a wonderful feedback that we did not know what exactly an Ayurveda doctor is doing.
True.
But since you explained each and every part of what exactly is
Right.
happening to me, I had the right to know, right to information that you provided all the information. You spent a lot of time. My consultation goes somewhere around 45 minutes to 1 hour. Sir.
Right. Beautiful, sir. Beautiful.
Yeah, so these two categories, yes, sir.
Right, sir.
Just your
Right,
opinion
sir.
on that.
Right, sir. Absolutely good point. But the point is, do you start giving information right at the starting?
Not absolutely no. So there the patient's hearing comes, as I said.
So first is that patients need to first you have to understand what to tell the patient. Even if you talk about, let's say, diabetes. Let's say I am a patient and I come to you. I want treatment for diabetes. That's one basic need of mine. I want diabetes to be treated. But why do I want diabetes to be treated? That's a different question altogether, right? What is my pain area? What is my key motivating area? What are the areas that I really value? What do I want to know? What are the areas that I want to know? Rather than giving a very generic, elaborate information. If you know what the patient really wants, then you can give more detailed information about what the patient really wants. That's what I'm trying to tell you, sir. And Hibar sir, I think you also have something to ask.
Yes, sir. I totally agree with Dr. Aman Kapoor here that doctors, though they have many things to say to the patient, we should be very careful in choosing our sentences, and we should be crafting the words and sentences very carefully to address the pain point only, and the we should not be talking in excess than what is required. You talked about told the word about over education that can be harmful. So if you're telling that, I mean, you have diabetes, so it can affect your kidneys, so it can affect your eyes, it can affect your nerve ending, so you have to take care, and you keep on explaining about the disease more and more. That sucks away the time from what actually the patient should be doing to take care. So I feel that disease explanation should be restricted. We should only communicate what the patient need to know. And
Very
in the first communication, somebody has written, Jay Raghuji has written, particularly in the US, we need to explain right from what is Ayurveda and all. So in the hundreds of sentences that we decide to speak, probably what Dr. Aman is saying is that we should handpick our sentences and communicate it effectively.
Thank you for putting it so eloquently, Hema sir. So, Jay, Swapna, I've coming to Mr. Jay, Dr. Jay. Simple thing is that you need to explain, but you need to explain what that person really wants. You many times I've seen doctors do this. Patient comes with diabetes and high blood pressure both, and the patient starts talking about. Patient says, doctor, I have at the moment you hear diabetes, everybody starts the pros, the cons, the diabetic cycle, and side effects of diabetes. Your eyes will get damaged. This will happen. That will happen, and then we go into depth. At the end of the patient, we don't even wait to listen. The patient is trying to say, "Doctor, I have diabetes. It seems to be under control, but my high blood pressure is not under control." So, so we need to sometimes pause, listen to the patient, and that's very important. And yes, keep it simple and short, and that's very important. Like one of my mentors, Dr. Madhavbaug, used to say, think in bullet points, write in bullet points, speak in bullet points. So by bullet points means don't fire the bullets at the patient. Just be concise. And when you talk about case papers, before filling the case paper, first listen to the patient. I'll come to that also. Wait, let me do one thing. I just change a few slides, and let's just go. I'm going to skip this part. And remember one thing: before you fill in your case paper, first you have to listen, give undivided attention to the patient. Please do not make notes in your case paper. You have done the x number of years of your medicine, Ayurveda, and you have graduated. You are intelligent enough to listen and summarize the whole thing in next few minutes. Generally, how do I do it? If somebody is talking, I would nod. I would say, okay, yes, I understand. Intersperse you this. Once you finish it, summarize to the patient, take the patient's permission with Dr. Mr. Hebbar, thank you for sharing this. Now, with your due permission, if this is what I have gathered from what you said, am I right? Am I understanding what you're saying is right? What you're doing by saying this is you're giving value to the patient, that you are important for me, and I am listening, and I am trying to ask you whether I've heard you right or not. Then take the permission of the patient, and then start filling the case papers. That is the time when patients won't be disconnected. They will respect you for it. So if you're talking about the case papers, listen to the patient, summarize, and then write the case paper. Remember, listening is not physical. It requires you to listen, hear, you have to process it, and then you have to analyze it. You have to give a feedback of that. Then only it becomes active listening, right? Can we close our eyes? Can you close your eyes? Can everybody close your eyes? Y or N? Yes, right? Okay, can you close your mouth? Yes or no, right? If there is a bad smell coming, can you pinch your nose and you can avoid the bad smell for some time? Yes, no, right? But Can you actually close your ears completely physically without any intervention and stop noise coming to your ears? You can't, right? Why? Because hearing is a way of our nature has built us, that hearing is a way of alarming us to keep us active, our brains active. You are asleep, you listen to a loud noise, you wake up, right? But when your spouse is sitting in front of you, for all those who are married, and says, I have something to say, and then all of a sudden you get your words are bouncing and they go up to your eardrums and they go boom and they bounce back out of ear. That's how it happens. So that's the difference between hearing and listening. Listening means when the sound comes in, you take it into your mind, you analyze, you digest that information, and then there is a connection between your tongue and brain and your ears. Utilize that network to then speak what is digested back to the patient. So that's the difference between hearing and listening. So doctors hear, but doctors need to listen a lot, right? Right. With due respect to everyone, and that's why I said spouse. I did not say wife or husband. It's a universal phenomenon. And if you go ahead and we try to understand, the fact that how do you become an active listener? You need to pay attention. The first thing I did right at the starting is when I started looking into my mobile, writing my notes, answering this, picking up the phone. I am being a non-listener. That's the first thing that you need to do. Second thing that you can do is show that you're listening. How do you show that you're listening? By giving responses. I like, okay, all right, okay, oh, is that so? Short responses, something that when you talked about TLC, what do you do when your loved one comes to you and is in pain? You give some responses, right? And that response, nod of your head, and anything is important. Dr. Akshata, if you have something, you can please ask. Unmute, ask, no problem. Okay, I think I'll proceed ahead. In case, Dr. Akshata, you can always unmute and ask, or for that matter, anybody, you have anything, just unmute and ask, no worries. The third thing is you need to provide feedback. And how do you provide feedback is when you listen to everything, you digest it, you summarize, and then you tell the person, ki, yes, is this that you have told, have I got you properly? Don't judge. Don't sit and judge. When the moment I said, the patients don't care how much the doctor knows, everybody starts judging to judgment. Typical corporate guy. He's going to tell us about no point in knowledge. Only marketing tricks are important. Only sales gimmicks are important. No, that's not what I meant. Don't judge till you get the complete story. Don't judge till you get the complete story. Defer your judgment for some time and respond appropriately. I mean, when somebody is saying, just because you have to respond, and somebody saying, doctor, I was in pain, and you are busy in your mind somewhere else, a cricket match or a baseball match or whatever you like to do, and then you say, oh, wonderful, and then you realize, oh, my response is not appropriate to what the patient is saying. So this is where we start off from. And I think for the paucity of the time, maybe we can skip too many of the things, but if this is very, very simple, straightforward part about listening, we can cover more in detail about how to question, what are the ways of getting your patients to answer, what is the right time to present the treatment to you, what are the different things. Those things we'll discuss in more detail if you want. Hebar sir, yes, please, sir.
So one point that I totally agree is that we need to listen to the patient with undivided attention. This many people who have met Mr. Modi have told. He will listen as if Mr. Modi, being the PM of India, he doesn't have any other work but to listen to you as long as he's speaking. He will listen and ask deep questions regarding what you're saying, though he has like 100 things in his mind. So probably that is very important. But another question that I have is, I also face this a lot doing online consultation and all, is patient will be, when the patient starts speaking that, doctor, I run 5 kilometers every day, then one day I went to hiking. That was like 3 years before. There I twitched my ankle. Then suddenly after that I had fever. So then somebody diagnosed it as rheumatoid arthritis, but it was misdiagnosed. So somebody told it as gout. So he keeps on saying, and if I do not at least say, I mean, okay, it's not a good idea to write the whole story. At least if I'm not making important points, writing down, I may especially in my case, I may forget the sequence, or again after the, if I'm totally listening to the patient, I may again ask a few questions to again explain his symptoms. Is it okay, I mean, if I tell the patient that, I tell it ahead that, I'll be taking some notes, but please go ahead, something like that, or how to?
So I understand your point. When there is a lot of complex things that a patient is saying, you are worried that you might miss something in between, and that's why you would want to take notes. But what I have noticed, sir, and what has been seen with people I have discussed this with, is that at the end of when the patient is saying, and before you take the notes, when you summarize what you've heard to the patient, what the patient has said, and when you summarize your findings in brief, that is the time when you give two things. One, you understand whether you have captured the right information, and two, if you have missed anything also. So instead of breaking the flow of the patient, sometimes it is while important to break the flow, and the patient story goes completely off track, while talking, and the patient will start talking about Ukraine Russia war, and from there he'll go to World War I, and then to the history of mankind. If something like that happens, you might have to break that flow and get that person in between. There are certain subtle tricks in body language that you can do that. But as far as possible, if the flow is very relevant, just hear to the patient, listen to what the patient is saying, and then summarize it, and then do it. And if you have missed anything, the patient will automatically say, and it's nothing wrong in apologizing to the patient and saying that I'm sorry if I missed anything.
That totally makes sense. Thanks. Yeah.
So, if you want to really have your patients listen to you, start by listening to them. That's the first and the most important step. The second step is, if you want your patients to listen to you, make them comfortable. Nobody walks into a doctor's clinic because it's a theme park and they're going to get to enjoy some nice rides. That's a ride that nobody wants. And a patient walks into a doctor's clinic, they're already scared. Don't scare your patients more that, oh my God, diabetes, your eyes will go, your nails will rot, your this will happen. You already know all that. That's the reason why they are there to you. And find out the real pain of the patient. So there are different schools of thoughts to do that. Find out the real pain of the patient, and when you find out the real pain of the patient, you will be able to give the real solutions to the patient also. So this is in very short that I have. Hebar sir, over to you, sir.
And another point that I have seen, like I was working in with a psychiatrist, and he was so effective in communicating that, highly aggressive psychiatric patients who would come with a knife and who have that killer instinct. Many of them, unfortunately, these criminals, unfortunately, are psychiatric patients untreated most of the time. So they would come with a knife, and he would, just with the talk and the way he was dealing with them, he would just calm them down. And I was surprised that he was making them to answer his questions. So it was it was really magical to learn from him. And one of the skills that he was using, which we all can use because we are doctors and practitioners, was one is that being sitting very close to the patient, not like across the table. That is not like a multi-million-dollar business meeting that is happening across the table. He sits right next to him, and like very up close and personal, listen to him. And then and also like teenagers having psychiatric problems, they do not open up, but he was having this skill of like slightly gently tapping to the shoulder, tell whatever speaking will not go out of this. I'm your friend only, I'm not even going to tell. So while variation in sound volume of the speech, and also the touch also. So, and even we can show that we are really caring in how we do the even the simple auscultation and the palpitation, etc., that we do. We can, is it paining here? Out of 1 to 5, how much is the pain? Is it better now? Or what is causing increase of pain? So we can use touch also to get up close and personal with the patient. So.
Absolutely, absolutely agreed, sir. Many of you must be knowing Dr. Devi Shetty. He is the founder of Narayan Hridayalaya. Amazing person. And at a person who's one of the world's leading cardiologists after doing so many surgeries. If you see him, hear him, he says by the time a patient comes to him for a consultation, he knows the prognosis, he knows the diagnosis, knows what is going to happen, how the patient is going to fare, what is going to be the outcome. He understands everything. He doesn't even need to see the patient, but yet whenever a patient comes into his chambers, sits with him, he will take a stethoscope, touch the patient, feel the patient, and I mean in a medical manner. So, so you have to have the doctor's touch to the patient. And it's very important because that you have to bond with the patient. It's all about connecting. It's all about bonding with the patient. And that's the only way. When you bond with the patient will start believing in your care, and then the patient will start responding to your care appropriately. And like you said, sir, small things, very small things are very important. Like, for example, when you're putting a stethoscope onto the bare skin of a patient, just warm the bell of a stethoscope. You don't put a chilled stethoscope on the bare skin of a patient and then you expect the patient not to have increased heart rate. Most of the times when the patient is having high blood pressure is the times when the patient is seeing the doctor. So white coat hypertension happens. That's the reason why, as doctors, as medical practitioners, as healthcare practitioners across every field, whether you are in Ayurveda, whether you are in allopathy, whether you are in naturopathy, whether you're in any field, start by doing small things. One very thing I do in a classroom sessions that I should take is that I would assign random numbers to everybody, like number 1, 2, 3, 4, 5, 6, let's say we have about 25 of us here. Let's say I assign one number to each one of you, and then I say, okay, I'm going to play one of the most idiotic, stupid, and a song that you wouldn't, and then you have to dance in front of everybody, whose ever number I call right now. Even on this, if I say out of 25 people, if I say, I'm going to take random names and I'm going to play a very a stupid song, like for example, the King of the Jungle dances tonight, something like that, and I'm going to ask you to dance in front of everyone. Would you dance? Would anybody be comfortable in dancing? Would you dance? Would you be comfortable in dancing to this? Yes or no? If I suddenly just say I'm going to put a song and anybody's name, no, right? The reason is that you're not comfortable. And the same thing in the evening. Suppose if we, it's in a disc, in a pub, or in a party setting, and the same song plays, everybody would be dancing to it. Everybody would dance to it, no matter how silly the song is. Whether it's the bird song, ta 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 ta. Even you would dance to that also, no matter what, because the environment, you're more comfortable in that environment versus more comfortable right now. So think of your patient. Your patient is scared. Your patient is afraid. You have to do everything that you can do to make your patient comfortable. Your patient is your guest, like in, we say Atithi Devo Bhava. How would you treat God if God would have come to your house? Treat your patients like that, not like a kidney walking to your clinic, or pancreas walking into your clinic, or a gallbladder walking to your clinic. There is a body attached to it, there's a person attached to it. So think of a person as a whole and not as a whole in the person.
Yes, sir. The program sir respond, please.
Yeah, coming to this, wonderfully said, sir. Good interactions. I did not want to meddle in between. Well, about patient hearing and also documentation, should we make the notes or not at the same time, or should we listen and make the notes at the last? Heber sir's question also was really valid there and rightly answered by Aman Kapoor sir. Sir, here what happens is the doctors may get a ready-made notes, the notes coming into the doctor's chamber before the patient comes. So like they will read, somebody else is doing the work for them. So outside the junior doctors or somebody doing that work, the notes comes in, they would have read by the patient by the time the patient has comes in. So here I have seen the patients telling that, okay, why should I tell my complaints to you rather than that I'll go and narrate it to the doctor? The doctor should have time to listen to all my complaints. So then there will be a rush outside. So that is scenario number 1. So scenario number 2 is doctor making his own notes while listening to the patient. There the patient might feel that the doctor is distracted, as you rightly said. But if I don't make notes, so this is a common question, sir. If I don't make notes as a doctor at that time, I have a rush outside and I need to do the follow-up also. By the time I can't make the other patient wait outside my clinic until I finish off my notes of the previous patient and then I'll press my bell and let the next patient in. So the simultaneous work has to be done, small notes, because next time the patient will again come to me and I should be knowing the history of the patient. So these two scenarios are there. So what is the best way to take to balance these things happening in the clinics or the hospital?
Beautiful, sir. Beautiful question. So your question is that, there is a rush of patients. I need to make notes. I need to see the other patients. I need to do a follow-up. I'm one and all. How do I manage all of these together, right? Am I right, sir?
Right, sir.
Right. So, have you heard about AM, PM?
Yeah.
What is AM, PM? Time, right? Morning,
Right.
evening. Like that, there is AM, TM. Have you heard about AM, TM? AM and TM. TM stands for time management. AM stands for appointment management. Right? Doctors feel very happy when when you open the door and you see a flood of patients sitting outside. I'm a very successful doctor. No, you're not successful, because there are a flood of patients waiting. And when I was in the initial stages of my dental career and had just graduated, there was a dentist who used to practice in an area where I stay. His practice clinic used to close at 2:30 a.m. in the night, 3 a.m. in the night, and his morning practice would end by 4 p.m., 5 p.m. And used to feel, wow, such a long practice. And at the end of it, what we realized, patients come, they take an appointment, they sit over there, watch a full Hindi movie. At that time, the movie would be 3 hours long. They would go, come back, and then their appointment would come. At the end of it, doctor burned out, the patient burned out. If you want to give quality time to your patient to have a quality practice, please space out your appointments. You are not successful by having a huge rush of people outside. Yes, there will be times when you will have more rush, but have an appointment management system wherein you give your patients sufficient appointment time. Prefer people coming in by appointment. A new patient will walk in anytime. That's a different thing altogether. But as far as possible, manage your appointments and time in such a manner that you give each patient the valuable time. And second thing, to do that, please don't do free consultations. I'm sorry, this sounds very businessy, or it sounds very money minded. But until you value your time, your patients will not value your time. And your first consultation is the most important consultation that you can give to your patient. You need to respect that. So, sir, with due respects to you, schedule your appointments in a manner that you have sufficient time for your patient. And if you are extending that appointment time, like for example, you're given half an hour, if you're extending by 5 minutes, 10 minutes, inform the next patient, apologize to the next patient that I'm sorry that, the previous appointment is getting delayed by about 10 minutes or 15 minutes. Apologize, have your assistant, you don't need to go out, but have somebody do that to the patient. So that can help in the long run, sir.
I think you already answered this question, sir. So this is another approach. So like in Munna Bhai MBBS movie, there are two characters. Like the dean tells, look at the patient as a subject. That's all. Don't connect to the patient. So because if it is my son or my daughter on the surgical table when I'm operating, so I may get connected to that person. So I may not be, my hands will shiver while doing the surgery. So look at a patient as a subject. On the other side, there is Munna Bhai who tells just give jadoo ka jabki. So like hug the patient and connect to the patient. So which way would be the best? What would Aman Kapoor sir do? So most of the times to the patients, or should we mix up these things, make a cocktail? Jadoo ka jabki, have a look at the patient as the subject, as well as have patients listening, make notes, give jadoo ki jabki, as even Heber sir was telling about the psychiatrist who used to touch and feel the patient and comfort the patient. Is it a mix and match of all these things, or should we discrete things when we approach patients?
Lovely question, sir. Let's start with a little bit of humor. If you give jadoo ki jappi to all your patients, you might get sued today.
Absolutely, yes.
Now, jokes apart, penicillin started off as a medicine. You must be thinking I'm asking about patient consultation. I'm talking about penicillin, but hear me out. Penicillin started off as a wonder drug, right? Wonder injection, which was injected and used for everything. Over a period of time, penicillin lost its attraction. We now know today that there is no one drug that can fit all the infections. So your approach needs to be a blended approach. Don't be too offhand. Yes, while the thought process is that if you are too emotionally connected, you may not. So there is a philosophy of personality styles. Everybody has a different personality style, and based on your personality style, you would have a different way of approaching the patient. What needs is that you need to be able to bring the best of both the worlds. You have to care enough, and when needed, you have to be rational enough also. So don't be too cold, and don't be so emotionally lost that you're not able to do the right thing for your patient.
On the other hand, Aman Kapoor sir, people feel, not only feel, they're experiencing that the care, empathy, and love from the doctor side is being reduced through the decades. Nowadays, when we look at the past half a decade, so there are some attacks on the doctors as well. Okay, so I do 99 good things, and when I go wrong one time, so even so that may be an error, some error, a treatment error or something which is not, which has gone out of my notice. So then there is a sudden attack. So the same people who believe you might attack you. So here doctors are playing safe game. So like I will not advise anything beyond certain things. So they have confined themselves within the bracket of practice to what to advise, how much to write, what medicines to write. We will go very, very, very safely in terms of speech and deeds and prescription and everything. What is your take on this, Aman Kapoor sir? So should the doctors be thinking in that way and confine themselves, or is it the high expectations of the patients, like doctor is not so and so what I'm expecting? So there are two expectations: doctor's expectation, doctor's performance wise, and also the patient's expectations wise. So when there is imbalance of this, the healthcare system will obviously collapse and will fail. At small units maybe, and when many people do that as a system as well. So how to balance this?
Right. So unfortunately, with commercialization and with consumerism that has come into picture, these things are being faced, and everybody is thinking of their own safety, which is natural for it to be happen. There was a time as kids we could go to our doctor, the family doctor, where we would go for treatment, and not just for treatment, we would go to our doctor, and we would take our mark sheets, the report cards. There's a family feud. You ask a doctor, doctor uncle, I'll tell doctor uncle that you're not listening, you're not doing your homework. That kind of relationship was there. Now with time, things have become more commercial, more professional, more transactional. But still, if you see the best of the best people, whether they are from any faculty of healthcare, everybody talks about one thing, is that care enough for the patient. You have to care enough for the patient. And when your patient, and it's not about showing care, it's about really caring. When your patient believes that you cared, when you are a trusted advisor of a patient, where you have built a bond with your patient, where you have at the same time documented everything, kept all your legal aspects clear, two things will happen. One, if something goes wrong, and no medical treatment is 100% successful. If it is 100% successful, it's magic, and there's no magic in the world.
So first of
Every
all,
treatment will fail sometime or the other.
yes, sir. Last tag question about this, what we're speaking. The question may be, as me, not as a doctor going into a hospital, where is love, care, and affection when you people ask for the insurance card before even asking the symptoms?
True, it is sad, but the point is that if you focus, my surgery professor, oral and maxillofacial surgery professor, used to say this thing, Raghuram sir. When we were doing a differential diagnosis, he would always start with a differential diagnosis. He would not ask us for a straightforward diagnosis. And as students, everybody is very keen of giving very rare things, like Google does for us nowadays. You type anything, the answer will be cancer. So when our doctor was, our professor used to do that, we would always lead by saying something that is very rare. And he used to say, if you think about rarities, you'll be rarely correct. If you think about rarities, you'll be rarely correct. If you focus only on the negative side, you will see only negative. If you focus only on the positive side, you'll see only positive. If there is a well which is painted blue on inside and red on the outside, person standing outside the well will say the well is of red color. Person standing inside the well will say well is of blue color. Both are right and both are wrong. The only person who is having the right view is a person who sees the view from top and who sees that the well is blue on the inside and red on the outside. That's the way you'll have to focus. Yes, there is commercialization. There are insurance. We have to see that, yes, has it eased? Yes. Has it reduced out-of-pocket expense for patient? Yes. Has it improved the availability of quality care treatment to more number of people than it could have been possible. Yes, there are a lot of positives of it. Negatives are that there are somebody in between who are not accustomed to it. So our job in wherever hospitals, clinics, wherever we are, is to train everybody to have empathy. A truly good hospital believes in empathetic care, whether it is a person sitting at the inquiry counter or a person sitting at the CEO's desk. Everybody will have empathy. That if it is missing, then it is our job to, as leaders, to lead and ensure that people learn it.
Thank you, sir.
Yeah, to sum up this today's session, we should be empathetic, listen to the patients before we start writing or we start judging the consent diagnosis and educating the patients. That is one thing. And second one, probably to counterbalance that, we should not be like too much emotionally attached, or we are not here to take the patients to our home. There is some margins, we should be respecting that as well. So thank you, Dr. Aman Kapoor sir, for this enlightening session. We'd like to have you more of these sessions from you, from for many different topics. This particular session was regarding the communication and the relationship development between the doctor and the patient. It was limited to that. Of course, there are too many other facets of patient and doctor relationship, which we'll explore with the help of Dr. Aman Kapoor in future. On behalf of us, all of us, I express my words of gratitude to Dr. Aman Kapoor and Dr. Raghuram sir.